Okay, so welcome everybody. Today we're very pleased to be hosting this event at the HNPW, and we're going to talk about linkages between social protection and humanitarian cash and voucher programming in the response to COVID. This event will last, can I have the next slide please? This event will last between 75 and 90 minutes. There are various hashtags you can use, including Social Protection CALP Network. You can see them there. Please submit questions to the Q&A box, not the chat. Please introduce yourselves in the chat box, let us know who you are, but use the Q&A box for questions. All mics, apart from those of the panelists, are muted, which is why you have to use the Q&A box or the chat box. Please note this event will be recorded and the recording will be shared online. And if we have anything like a Zoom hacker, staff will remove and block the offender. Thank you very much. Next slide, please. So I'm delighted to welcome our panelists, and I'm going to introduce them in alphabetical first name order because I kept thinking, who first? But we have Catherine Tate with us today. She has over 20 years global experience in strategic and operational humanitarian response, academic research and private sector collaboration in fragile and natural disaster affected contexts. Currently, Catherine is the Global Director of Humanitarian Partnerships and Cash Voucher Programming for World Vision International. And Catherine is also the Chair of the Cash COP Board. She's a co-lead of the Interagency Collaborative Cash Delivery Platform. And she's a member of what was the Grand Bargain, now the SPIAC-B Humanitarian Cash and Social Protection Group, among other engagements. Matthias Lundberg has stepped in at the last moment because, as with so much over the last couple of years, Ugo Gentilini has COVID, everybody has COVID, COVID affects everything. So Matthias, huge thank you for stepping in at the last minute like this, and we're super, super grateful to have you with us. You're the manager of the Rapid Social Response Umbrella Trust Fund, and the Partnerships Advisor for the Social Protection and Jobs Global Practice of the World Bank. Matthias has led research and programming on gender, youth employment, HIV/AIDS, financial inclusion and income distribution. And he's also worked on the reintegration of child soldiers, nutrition, health sector reforms and other issues. He's published widely on these and related issues, as well as poverty and social impact assessment, human capital investments in crisis, and risk-taking in health. And just now, Matthias is working on social protection and livelihoods programming for women and young people, and on displacement and refugee integration. So he's incredibly well placed to think about the what next bit. Nupur Kukreti is a policy specialist for UNICEF. She's based at their New York headquarters, and she leads their portfolio on social protection in humanitarian, fragile and risk-prone contexts. Nupur is like the humanitarian who's gone over to the other side and is bringing everything together. She authored the first Sphere standards on cash in 2011, and she also has a strong background in the design and programming of humanitarian CVA, and she led the way with the first global guidance on linking social protection and humanitarian assistance. She's another co-lead for the Grand Bargain Social Protection Interagency Cooperation Board Working Group on linking humanitarian cash assistance, social protection, and we're so pleased to have Nupur with us today. Rosie Bright is a social protection advisor for WFP's Global Social Protection Policy Team, and we all know what great work WFP is doing in this linkages area. And Rosie focuses on providing cross-cutting support. Prior to this, she headed up WFP's social protection and cash-based programming team in the East Africa Bureau, and she has over 10 years experience in East Africa with both WFP at country level and regional levels, and with the former UK Department for International Development, the much lamented DFID. So welcome everybody, thank you so much for joining us. And also thank you for the contributions you made to the article that we're sort of reflecting back on today and we're also looking forward from. So CALP is very interested in more appropriate programming for the increasing crises we see today. And that's why we have a focus in this area of where cash-based humanitarian action meets social protection approaches. And we'd like to see, the focus get bigger than that. COVID-19 probably brought about the strongest linkage to date globally between social protection and a major crisis. So social assistance is mostly in the countries that we're thinking of, in the context that we're thinking of. It's designed to deal with extreme poverty or life cycle vulnerabilities. And in many contexts, sometimes with external support, we saw massively rapid adaptation or expansion to meet the new poverty or new vulnerabilities caused by the COVID crisis. And much of this response used cash. And I'd also like to say just at this point that much of this response was also only possible due to earlier investment back in 2008 with the FFF crisis. That laid foundations to help us move from 20% coverage to 40% coverage globally with social protection interventions, although a lot of those won't be that adequate. So, next slide, please. So, we wrote a paper. It was crowdsourced. We asked stakeholders, usual suspects, friends of CALP, and we also did some reading. And somewhat to our surprise, the article was published. And then we started to think, well, what if what we said held true? We didn't just look at social protection linkages, we looked at remote working, digitization, localization. But a year later, what's still in place? What was just a big bang for an emergency? So that's what led to this event. Next slide, please. When we published the article, we found, yes, there's been a massive increase in social protection programming as a response. Cash has been used. It's built on earlier investments in social protection. And increasingly, particularly in these low-income, fragile contexts, we're seeing a blurring of lines between humanitarian and development action and support to governments. Next slide, please. And the key findings were that there were lots of innovations going on, whether this was new caseloads, new geographies, the urban context was very important this time round, novel targeting, new sources of data, adapting operational systems, remote working, digitization, coordination, funding sources, the speed, lots of innovation, rapid response. We also found that it was critical to maintain existing systems so that they could keep delivering to populations that were already extremely poor and very vulnerable. But there were key limiting factors, and these were what existed before COVID in terms of systems, funding, political will, and the relationships and trust that would allow for innovation. We were hearing at the time of shortfalls, that the response had been rapid, but there were shortfalls in terms of coverage, in the adequacy of the amounts given, the timeliness, how long did you have to wait, and the duration. Was it just a one-off? Was it 2 payments? What was it? Was it enough? And we also heard that there were unavoidable trade-offs between these different dimensions of response. Next slide, please. Now, when we envisaged this webinar, we were thinking that we would be moving away from COVID. We knew that crises would be continuing because they have been, and they've been getting worse and more complex and compounding. But, we didn't get much of a breathing space, did we? So we're seeing the economic and health impacts of COVID continue. We're seeing very serious food security crisis in the Horn of Africa and the Sahel, growing poverty, and increasing vulnerability amongst refugee populations and the displaced. And these are being driven even harder and faster by rising inflation, by fuel and food shortages, and we're seeing the knock-on effects of the conflict in Ukraine after the Russian invasion. So one of the questions we want to look at in this webinar, and we'll be asking our audience as well as the panelists, what difference have the last 2 years made? Okay, so I think we can get rid of the PowerPoint now and see our audience, our panelists, not our audience. That would be a little big. So The first question is to all of the panelists, and it's looking at this adequacy issue. What is your thinking now about the adequacy of the response through linking social protection and humanitarian support, or one sort of manifestation of that complex area in the context that we're interested in terms of coverage, targeting, comprehensiveness, duration, timeliness, and what were the enabling or challenging factors? And Catherine, why don't you kick off here? Because you were the first person I introduced, and we'll just go in introduction order.
Thank you so much, Julie, and thank you everyone and my co-panelists to have this wonderful opportunity to share. I do think from a civil society perspective, we have seen that actually the needs have increased, as we see. Unfortunately, there is, with the expansion of COVID-19 social assistance scale-ups all over the world, still only 10% of the population actually was covered in most of the sub-Saharan Africa. We have seen that about a new poor community has emerged, unfortunately, from 26 million to 40 million new poor people. That's according to a World Bank report in 2022. And we have seen that, especially in fragile contexts, about out of 43 economies with the highest poverty, 1/3 are actually fragile and conflict affected. So just to even put some numbers to what you've just described as current landscape shift. Now, what has changed or what have we learned in terms of the challenges, but also new opportunities coming because of these challenges? We have seen that on one hand, there has been much more connection between humanitarian cash and voucher assistance actors and the social protection mechanisms at large, facilitated by national governments, for example. And we have seen that just because also of the efforts of, for example, all the organizations that are represented in this panel and beyond, but also because of a lot of civil society actors that have reached out more and tried to help fill gaps. When we're talking about adequacy, we know that adequacy looks at the affordability and availability, accessibility and quality of services. And we know it's never enough. But I do think we have seen a progress regarding the fragmentation of the linkages of humanitarian cash voucher assistance and social protection. However, there are still gaps. We know that when it comes, for example, that to the point of having different criteria for targeting, understandably so, because different benefits packages have to address different vulnerabilities. But because of that, sometimes responses in scale up has been slow. For example, in Uganda, we have seen that at the beginning of the pandemic, for a couple of months, there was a discussion about the most appropriate protocol, the operational protocol to support COVID-19 affected households. And also we know that, for example, school feeding benefits in many contexts had to stop because schools were closed. And not every government, not every actor was able to actually step in and replace that with cash transfers to children that had to stay at home and do online learning in the best case scenario. So as we see that the fragmentation is there and the gaps in the adequacy, we've also seen that there has been a lot of innovation and approach by even civil society organizations, including members of the Collaborative Cash Delivery Network and also World Vision, my own organization, looking at linking social inclusion with financial inclusion, linking, for example, community savings groups much stronger with already existing or exiting humanitarian cash transfers, so that we actually enable financial and digital inclusion, given that 50% women actually represent the unbanked adults. That's a huge percentage. Over 1.7 billion people are not having a bank account still. And so with savings groups, we have reached, for example, in World Vision, about 1.6 million members, facilitated this link to more intentional opportunities to link humanitarian cash transfers to financial resilience building. While that is happening, we still have about 1 billion children globally that are multidimensionally poor, meaning insufficient access to food, nutrition, sanitation, health, education, and so forth. And this has a lasting impact on economic, socioeconomic resilience building in their future, in their adulthood, and therefore also in their local economy. So I do think I'll stop here. There are other points which I do still think we need to address much better, but it's not enough progress yet. Thank you.
Thank you. Matthias, over to you.
Thank you. let me say a couple of things about the World Bank. I'm not often, shall I say, proud to work at the World Bank, but occasionally I am. And occasionally the institution really can pivot and can make a change in dramatic fashion. And it happened with the HIV crisis, it happened in 2008, 2009, and it happened now. The bank has a portfolio of about $60 billion a year, and over the past 20 months or something, it went up to 120 billion. And that's astonishing, right? So my colleagues have really responded in a very impressive way throughout the institution. And in social protection and jobs, which is where I sit, our portfolio, we usually have, say, 5 billion a year in operations, and it went to 12 in 18 months. And that's kind of breathtaking, right? I mean, with the same operational or whatever you want to call it, managerial resources, we more than doubled our response. And that's, I think, indicative also or representative of the great response that has happened among our partners and clients. Ugo's magisterial inventory, you know, this list of 4,000 plus or nearly 4,000 programs in 200 plus countries. Julie, you mentioned the food and fuel crisis of 2008, 2009, and this vastly exceeds that, right? I mean, an order of magnitude, if not more than that, increase in the response. So that's wonderful. I'm seriously deeply impressed by everyone who has responded to this crisis. Now, this is, if I can be maybe slightly cynical, I think this is partly engendered by or enabled by the fact that it's truly a global crisis, right? It's a pandemic disease, and pandemic diseases cross borders. And so we're sort of our radar, our sensitivity is heightened, right, to things that truly have these external effects that are sort of rapidly expanding, infectious, right? But more than that, if I sort of, that's just a cynical aside, but we also recognized, and I think, Julie, you're right about the food and fuel and financial crisis, that we have recognized that social protection programming, humanitarian programming, the direct support to livelihoods and lives and well-being is of fundamental importance, and that we have the tools in principle to respond, right? So that's great. And as I said, I think we learned that over the past 10 years. But as Catherine said, the response has been plagued by, you know, low coverage and insufficient benefit levels and questionable targeting and maybe capture and so on. And so we're not there yet. And we can talk in a little while about what's happening now with the price changes. And let me say two other things. First, we're not out of the pandemic yet, right? Particularly in East Asia Pacific, they're still suffering the consequences of new infections, and so we can't say we can't declare victory just yet. And secondly, as well as the increased poverty and the sort of the setback in the fight against poverty that we've seen over the past 2 years, we also have to deal with things like the global learning loss, right? And the numbers that are coming out are truly stunning and horrific, of a nearly 2-year loss in education, human capital investments, and we don't know whether those will accumulate or will attenuate. We're not sure what's going to happen, but it could be a 20% loss in lifetime income. And that's I think horrific and may have consequences for the future that we really need to think about now how to respond. Thanks.
That's brilliant. So over to Nupur, please.
Thanks, Julie, and thank you for inviting me to be a part of this panel. Really, really honored. So let me just take you back, and I think if I can say that, and not sounding like a dinosaur here, that I think COVID is what tsunami was for cash transfers in emergencies. If you remember, 2004, that is the time when the crisis was so huge and cash transfers were implemented by various agencies in different ways. And that really changed the whole scenario for emergency cash transfers. Look at where we are now. The reason why I'm bringing this up here is because I'm assuming that large part of the audience here comes from a humanitarian cash background. So for social protection in emergencies, COVID is what tsunami did for cash transfers. I see it that way. Yes, of course, we had the triple F crisis, but as Matthias just said, the magnitude of this is huge. So, and the response that we've seen is from governments is also huge compared to what we've seen in the past. So, I just see this as a starting point. And we hope that there will be much more of this. Hopefully the crisis will reduce, but if and when there are more crises, then we will see social protection in emergencies really, really growing strongly. And the bond between cash transfers, but not just cash transfers, humanitarian assistance, the bond between the humanitarian assistance and social protection strengthening further to be able to support people. Now, again, taking a step back, remember when COVID happened in the beginning, the entire attention from the humanitarian sector was towards COVID being a health crisis. The socio-economic crisis that accompanied the health crisis was in a way neglected. And this is where the governments came in and they stepped in. They were looking at providing that support early on, breaking the silos, because the governments tend not to look at just a health pandemic. Of course, they were putting in measures to contain the crisis, but then there were other things, the other implications that they had to deal with. And they started putting in social protection. Some humanitarian agencies did start making a noise early on about the socioeconomic crisis, and some of us who are a part of the what was earlier called as the Grand Bargain subgroup on linking humanitarian cash and social protection. You might remember Catherine, Matthias, Julie, you yourself, and WFP was also part of that group. We were making we had started talking about this very, very early on. Significantly scaled up, the group significantly scaled up the knowledge management portfolio. So we started organizing these webinars, we started having weekly newsletters to start bringing the issue out into the humanitarian domain. And yes, we did humanitarian workers, we did catch up very, very fast. So just wanted to bring that back. Now coming to the issue of coverage and timeliness. So timeliness, of course, wherever the governments were prepared, wherever there was work around preparedness, which was already existing, and where there was a lot more work that had gone on for strengthening social protection systems. And I can say that given that UNICEF has teams on social protection in about 150 countries, and we reached about 46 million people plus through the through the COVID response, social protection response, supporting the governments and some of it ourselves. Wherever we had worked, or wherever other agencies had worked on preparedness, governments were able to scale up much faster, and the coverage was better. And I can give you the example of Mongolia, which might probably answer all the questions that you had about timeliness and adequacy, etc. In Mongolia, there is something called as a child money program, which is a near universal program covering almost all the children in the country. Now, this program was significantly scaled up by the government, 5 times the amount that is transferred to people on a regular basis. And this was not for a month or 2 months. This was, I think, for 15 months. And this was not the only thing. There were other mechanisms. The social pensions were increased, I think, for about a year. And then there was something called as the food stamp program, which was also increased for about 5-6 months. So there were a combination. Again, it's when we talk about comprehensiveness or the adequacy of the transfer, it's not just about cash transfers alone or one program alone. It's a combination of all that. So together, it was good. And this is where it's a country where there was work going on before, on testing and checking whether the system can be scaled up, can include new people, etc. So it did work, and the government, the demonstration value of what can be done was already there, so it was easier. Of course, you know, there are always gaps. Nothing is perfect in this world. There are always gaps, and that's the reason why I said, you know, this is the first major crisis where we were able to test out quite a few things, and there are quite a few learnings that have come out from this experience that are going to help us moving forward on this. So with that, you know, I will stop here. I'll maybe come up with other points later on, but want to leave you with this idea. The last point, sorry, I forgot to mention, and a very important one at that, is when we talk about adequacy, the question that we need to ask ourselves is, how do we define adequacy? Because is it adequacy based on the sphere standards which are used by the humanitarian sector, not necessarily relevant and used in the development sector? Because when we in social transfers, when we are deciding on the transfer values, that's very much based on incomes or expenditure patterns at household level or the poverty threshold. But in the humanitarian sectors, there are certain standards, and then the question is whether those standards are mandatory or are they aspirational, and whether people are in normal contexts, in their normal lives, and especially in low-income countries where large sections of the population are already very poor. That's the reason why small shocks also turn into crises for them. So in those kind of contexts, what should be the adequacy? Should it be the sphere standards, or should it be poverty? What should it be? Then that's a question I think we need to debate moving forward. So over to you, Julie.
So many big questions. Rosie, can I turn to you now and get a perspective from the WFP point of view?
Thanks, Julie, and yes, thanks very much for the invitation to join this webinar today. I don't think I should talk for very long because I don't want to say things that have already been said, and I think I very much agree with you know, what colleagues have said before me. You know, your question had two parts: was the response adequate, and what were some of the enabling or challenging factors? And I think, yeah, overall the response is quite clear was not adequate. You know, we've heard already about the numbers of new poor, and we all know about some of, despite the great work that was done, the significant gaps that were unfortunately there. But in terms of enabling factors, I wanted to talk a little bit about preparedness, because I think, yeah, that's absolutely key. And I had a couple of examples, but Nupur, I think, you know, you've already kind of well made those points. Yeah, I'm looking forward to an interesting exchange and discussion today. So I'm going to skip over that, but just maybe to say that kind of in summary, in terms of preparedness, I think that, you know, the work that WFP has been doing increasingly on the agenda of linking humanitarian action, social protection systems in partnership with UNICEF and others, you know, working with governments to help strengthen their national social protection systems and help prepare them in readiness to shocks. Some of the key sort of elements that we've identified as enabling then that response are, of course, with regards to the policy structures, the institutionalization of government involvement in coordination, early warning systems, risk insurance, digital data management, and digital payment systems. I think they're all really important foundations that we were able to leverage during the COVID crisis. And I think, you know, the responses during the pandemic have also created and improved a lot of legal precedents and data management systems that were pre-existing, and emergency protocols, which can all help provide a framework for future shocks and give us that preparedness and readiness that we need going forward. Thanks.
So I tell you what, I was recently in a webinar where I was always the last to speak and there was never anything to say. So I'm going to flip this around. Rosie, you were starting to talk about what I think is coming up in the next question, which is, where have we seen opportunities that turned into real innovation or adaptations that are going to become permanent features of how we work in future? Is this going to be differentiated by technical areas? So it could be digitization, it could be data, or is it more about particular contexts and what existing systems allow? And what do we know of the user experience? So let's go the opposite way now. We'll go reverse first name alphabetical order. And Rosie, over to you.
Great, thanks, Julie. I mean, my reflection on this question, I think it's already been hinted at, Nupur, in your remarks about it being the first global crisis in which we could kind of test various things out. I think that the big opportunity that COVID presented was, that it gave us a global proof of concept that responding to needs arising as a result of a shock while working through and in support of national social protection systems is both possible and desirable. And it's, a way of working for humanitarians that we have to commit to continuing. And I also think that as a community of humanitarian and social protection practitioners, we have to dig deeper into examining the impact this way of working is having for people, that user experience that you referred to. From the WFP perspective, I mean, in 2020, of the 78 countries where we were working to help strengthen national social protection systems, in 65 of those, we were able to support governments to introduce new or scale up or adapt existing social protection measures in response to the pandemic. But this was an acceleration of a pre-pandemic trend of increasingly responding to humanitarian needs in alignment with and support of those national systems. And that's, often building on WFP's longer term support to government's routine social protection. But, COVID's provided us and our partners, many of which are represented to this discussion today, with an opportunity for significant learning and an appreciation of this sort of increasingly relevant area of work. So I think now we're very much in a good position to reflect on that learning and to ensure that alignment grows over time. I think there's kind of more space in our collaborative discussions on this agenda to focus in more on the impact this is having for people and the difference this is or is not making in their lives. Is the linking of humanitarian cash with national social protection systems delivering on expectations for those in receipt of transfers? Are enhanced efficiencies creating any in space to expand coverage or adequacy of assistance for people? And what about traditionally excluded groups? How do we make sure that they're being included, and are we holding our work to account for the extent to which it's reaching these groups? I think these are key questions we should be asking ourselves. At WFP, kind of partly in response to this, one of the things we're doing is focusing more on looking at user journeys to frame our support to national cash transfer programs. So unpacking the journey a recipient goes through from receiving information about a program, getting registered, receiving payments, using the money that they receive, with a real focus on perceptions and feelings so that we can better support government and partners to understand the pain points and modify approaches to help people feel at ease, well informed and empowered throughout. I think we're also in a phase noting that, the pandemic, as Matthias said, is not yet over, but reflecting on the evidence that has been generated through the pandemic response so far to better understand the impact of cash transfers that WFP was able to support to meet humanitarian needs through government social protection programs. So to give one example, in Ethiopia, in the context of COVID, we collaborated with the government to provide emergency cash to urban households through a top-up for pregnant and lactating women, temporary direct support clients of the urban PSMP. This was a vertical expansion, and as part of this work, we commissioned some sort of mixed method research, including a 3-round panel data survey to evaluate both the operational efficiency of that approach as well as the impact on beneficiaries. And we found that the cash top-up did indeed reduce food insecurity as well as the probability of experiencing severe food insecurity. But it also confirmed, gave us evidence to confirm that vertical expansion of the existing program was a viable operational model. It facilitated prompt response, reduction of administration costs involved, whilst of course noting that, the up-to-date data was critical and necessary precondition to ensure coverage of vulnerable groups. So I think we kind of need to shift to a bit more of discussion about, the evidence, the impact, so that we can further refine our understanding of the operational efficiencies of linking humanitarian cash with social protection, but also, and more importantly, so we can make evidence-based conclusions about the extent to which support's benefiting people and helping us move towards the bigger goal of nationally appropriate social protection systems and measures that are scaled up for everyone. Thanks.
Thank you. And we'll go to Nupur next. So innovations or adaptations that we're going to keep, ones that have really moved us forward.
Thanks, Julie. I will not repeat what Rosie has said, because she did talk about inclusion, etc. There are 2-3 things that I think are innovations and that will continue and should continue. Of course, inclusion is one of them, a big one. But on inclusion, I'm not repeating what Rosie said. I'll specifically focus on one particular type of inclusion, and that's of non-residents or non-citizens, if I can call it. Typically, social protection programs and systems don't necessarily include refugees and migrants, for example, into their portfolio. And some of it we did see play out in the COVID response, where there was a large group that was left out. But at the same time, we also have examples of countries where residents have been included into the program, into social protection program. And I can think of a few countries. I remember having this chat once a long time back with Matthias, and I couldn't remember the name of that country. I can tell you now, it was Guyana I was talking about. It's a small country, and when they expanded their social cash transfers, they included migrants into that response. So there are some countries, Brazil as well, allowed people from Venezuela to, policy-wise, allowed people to access social protection. Of course, there were problems with access. There might be some policy measure, but then there might be barriers that people may face in accessing those services and benefits, and that's where quite a few bottlenecks, at least as UNICEF, we saw them, and my colleagues in the country worked on ensuring that access of people to the services instead of providing those services ourselves. So, and it worked. So there are some examples of good practice that I really hope we can learn from and take forward. There are also examples of how humanitarian agencies have come and supported and worked very closely with governments to ensure that migrant and refugee population is not left out, while governments continue to support the citizens. I'm sorry, I'm getting caught up in this language here, but it's purely to make the distinction between people who are being left out traditionally in a social protection program. So there are good examples of how humanitarians have also worked very closely with governments to ensure that the coverage gap or people who are being left out from a government social protection system are also supported, and supported in the same way without creating any tensions. So that has happened, and I really hope moving forward, as I said earlier, that nothing is perfect. There will always be gaps, but these kind of examples give me a lot of hope moving forward. The other thing that innovation that I think started happening much more with COVID responses is better coordination between the cash working group and social protection actors in countries. I don't think the extent of that coordination that we see now existed prior to COVID. COVID literally kind of forced actors that were working on cash transfers in the development sphere and in the humanitarian sphere to come together. And that's something which is reflected also in the ISC agreement now on the cash coordination, where we're not talking about having very strong coordination between social protection and cash transfers, but social protection is mentioned, and there are entry points for the cash coordination to be better coordinated with social protection actors, and that's a big step, I think, moving forward. And this is going to continue. The more we do it, the more we will have better practices coming out, and this practice can be cemented further. The last point that I want to highlight here in terms of innovation is the use of technology. I know everybody's going to talk about it, and everybody out there in the audience knows about it. Technology, look how it has changed our lives. Going from in-person office to suddenly being online, and having all the workshops, etc., online. HNPW used to be in person. And now we're online. So, and that's so technology has really expanded in the space of cash transfers and social protection as well. I can give you the example of our Jordan country work that UNICEF did with the government, using technology to register people for the government social protection scale up. So there's a lot that has happened on the technology front as well that I think will continue to resonate for a long time. So over from my side on this.
Thanks, Nupur. This is all fascinating. I thought it was all going to be technology. But anyway, Matthias, over to you.
Okay, thanks. I won't talk about technology. Although no, I don't mean to be glib. This is a phenomenal development, and it really is going to change the way we work, and I think it will remain, right? That's one of the innovations that is going to be sustained. Let me talk about two and a half other things. So first, this crisis, this experience has strengthened the call for adaptive social protection, right? And also improved our understanding, so reinforced the idea that systems that exist, that are already in place, performed a lot better than those that we designed and implemented ad hoc. Now, we should have known this already, and there is pretty good evidence that this has been the case all along, and yet this comes as a bit of a surprise to some of us, that we need to invest in adaptive social protection systems, strengthen, make them resilient, and so on. Let's hope we learn better this time than we have in the past, right? Second, so I'm hoping that's an innovation that remains. Second, we've redefined vulnerability, and I think this is new, right? So there's a new push to cover the informally employed, the missing middle, which I think is a misnomer, but never mind, vulnerable people in middle income countries, and groups that have not until now been considered among the most vulnerable, where we need to pay some attention. This does not mean that we need to shift our attention away from the traditional target groups with whom we've been working, but to expand our understanding of what vulnerability means. And I think that's going to remain. And then the half thing, which isn't universal, but I hope it becomes so, and that is that many programs have dropped conditionality, right? And to me, I think that's wonderful, that there's an understanding that resources need to be delivered quickly and as widely, as broadly as possible, and just drop the idea of conditionality. We don't have the time or the resources to manage it, to the brain space to manage it, and it just screws things up. So I'm hoping that we learn that lesson as well. And the rest I agree with completely, harmonizing and streamlining delivery systems, the digital technology, all that, I'm totally on board with that. Thanks, over.
Brilliant. Thank you so much. Right, Catherine, you get the last one this time.
Thank you. First and last shall always be switching. Thanks so much. No, it's fabulous to hear what my colleagues have said. And in particular, I think I want to just amplify a bit 2 points that have been touched upon by Rosie, but also by Nupur. One is definitely from a civil society perspective, from an NGO perspective, we do see that there is progress in terms of attempts to include more vulnerable people. But what we've really seen is still missing, and what we as NGOs, among them the CCD members, for example, Oxfam, Save the Children, and IRC and others, and World Vision try to push further, is leveraging affected people's leadership in the whole issue around targeting, self-targeting, registration, enrollment in longer term or shock responsive and adaptive social protection programs. One example that we've highlighted in one of our toolbox publications a few months ago, and I will paste the link in a moment in the chat box as well, is using social accountability mechanisms to strengthen actually already existing social protection mechanisms by governments. And we've just recently had an update report from our team, that's World Vision in Cambodia, on the implementation of social accountability framework, engaging citizens to improve the service delivery through social accountability. That's actually supported by different governments, German, Swiss, Australian government, World Bank, and UNICEF, and obviously the royal government of Cambodia as well. And that was during the high peak of actually COVID, and COVID triggered social assistance transfers as well. So this was a government, or is an ongoing government intervention. And what multiple civil society actors did was really strengthening actually the awareness on the ID Poor, that's the program, cash transfer and social benefit system, in particular ensuring that access barriers were actually really identified. And for example, there was an on-demand system established by the government, replacing the prior top-down approach of registration of vulnerable households. And what civil society did was really strengthen local level information, follow up with household visits and actually mobile kiosks, and also strengthening engagement of community members with the facilitation of social audits and actually social performance scorecards, which brought together local authority leaders and community members. And out of the total of 44,000 citizens that participated in those 4 months, this was last year in 2021, more than 24,000 people in 112 communes in Cambodia took part in this, and even 3,600 officials. And the interesting thing is, as one result, it didn't lead to more conflict and maybe accusation. Why were these people that were vulnerable not included? But it actually led to authorities seeing that with more support to families to fill those requests for enrollment and responding to those requests that were submitted before this project started, but were not considered and so may have been laying dormant somewhere on a desktop or in a file, that was taken action upon. And this is really also helpful to know that there had been much more community communication and engagement about what the government actually offers as social policies, as protection, as social protection benefits. While we saw that approximately 20% of the participants in these information meetings were already registered in the ID Poor program, more than 50% of the citizens that were reached through those follow-up home visits and engagement activities actually also belonged to this criteria set that would qualify them to enroll into the ID Poor program, but they were not enrolled yet. So it shows that with civil society engagement, working hand in hand with the government, with other actors, we can trigger a mass kind of bridging the gap, ensuring more coverage and adequacy and quality of service support. Another aspect that I wanted to just highlight, because we're talking a lot about I would call them more stable contexts. And one of the key issues we've identified, obviously, in this session is that there's a huge issue around fragile context and protracted crisis and displacements because of climate change impact and because of this looming global hunger crisis and economic challenges that we're facing besides COVID. And one of the issues we have seen is the more we look at market monitoring tools and socio-economic and social cohesion monitoring indicators and triggers, the more we can prepare actually for impending system shock. And World Vision and other partners have worked on what we call a market-sensitive and conflict-sensitive tool that determines with community members and government and other stakeholders on the ground, what are triggered thresholds? Do we see there is more commotion, there is more social tension? And I do think this is very critical right now in preparedness for potential upcoming impact of further shocks, of further social unrest because of high in fuel prices, in bread prices, and so forth around the world. So those are two innovations that I do think from a grassroots level, in collaboration with other actors, are very critical to look at. Thanks.
Thanks very much. Now, the next question was a little bit targeted at Catherine, and I've obviously slightly skewered myself with this clever flipping I've been doing, but everybody's welcome to respond, although super quickly. But when we wrote this paper, there was what we heard back from civil society actors was that they were doing the last mile work. They were doing essential gap filling. And that is what you described in Cambodia in some respects. And it's also what we see in the UK in many examples. But in other contexts, do you think that's still what civil society were doing? Because we're seeing this major programming, we're seeing huge response from the World Bank, we're seeing UNICEF, WFP, UNHCR, other agencies supporting governments. What role was it, a gap filling last mile role for civil society, for INGOs, for NGOs? So Catherine, just give us a quick thought, and anybody else who wants to jump in, feel free, but otherwise we'll zoom on after that.
Thank you. Sorry, you have to hear me again very briefly.
It's fine.
It's a very good question. I'm the only NGO rep on this panel, so I apologize. We do definitely see there the gap filling in the last mile in particular should actually amplify further the role of local actors, and that is local civil society. They are the people on ground, even during COVID, as you all know. They were the first responders. They were the ones helping neighbors with food packaging or with other assistance when actually we had lockdown and market and movement restrictions, right? And many countries experienced those. So I do think the elevation of local actors as part of system strengthening, a holistic system strengthening also for informal social protection, as I said, for example, community savings groups, is really essential, and it's a key role for NGOs. Another aspect that I may highlight, and I know Matthias was not talking intentionally about technology, but Nupur did, and so did Rosie. We know that use of digital technology absolutely is critical and has helped with much more cost efficiency and reach and transparency. However, the issue of synchronized and interoperable systems across the board, whether that's NGOs, UN, national government, or someone else, is really, really critical because we want to deduplicate. We know still that there are multiple databases in one country context that may have the same person, the same recipient, even for similar assistance. And so that's not good enough. We need to make sure that we don't exclude people that are really eligible and vulnerable, and we don't include people double or triple times that actually would suffice with one assistance modality. But with that also comes the responsibility about we so few times actually talk about data protection, and also about the issue of the people themselves deciding on what data to share and not making that a conditio sine qua non that they have to register with all their personally identifiable information or tax number or something else. We know there are conflict contexts where this is really sensitive, where there are political contexts where this is becoming an issue, a crunch. And so when we look at innovation and civil society, like Give Directly did in Togo with the government cash transfer combination and using satellite technology data together with actual cell phone mobile user data and trying to triangulate who may have a zinc roof and who may be vulnerable or not, that's fabulous. That is a new and very refreshing approach to targeting. But still, it requires the people on the ground as well to engage and triangulate and verify and validate. And doing so with appropriate awareness and appropriate also ability and options for decision making on what data has to be shared with whom. So interoperable systems are critical, and everyone coming on board for that. Thank you.
30-second comments, or I'm going to move us ahead to the poll. I think I'm taking Matthias, quickly.
Matthias, can I jump in very quickly?
Very quickly.
Okay, and mention the importance of remittances in all of this. Until this past year, remittances dwarfed overseas official development assistance, dwarfed World Bank lending, right? So they're phenomenally important, and I think are even going to be more important over the next couple of years. Thanks.
No, that's a brilliant point. Okay, so now we turn to our poll, and this is where we ask the audience what they think about the next question. So the question first is, Today, we face continuing economic impacts from the COVID-19 crisis. We have critical food security crises emerging in the Sahel, Horn of Africa. Inflation is back with a vengeance. Refugee populations are poorer than ever. We have worldwide repercussions from the Ukraine-Russia conflict. I mean, oof. So have the efforts made during the COVID-19 response on using cash and linking humanitarian development and government response through social protection approaches given us an improved basis to move forward? Or are we overwhelmed? Is our funding and our systems, are they still inadequate? So please, here's the poll. Please take your time and vote. We've got a couple of minutes for this.
%25% have participated. There's still a few more minutes.
Thank you. Yes, do have your say, people. This is going to slightly sort of tell us whether we've got an optimistic or pessimistic audience, perhaps, but we really do want to know what you think.
Almost halfway there, 48% now. Mm, 70% of us have participated. Yeah. Julie, do you want me to aim for 80? We are at 76% now. Then I can end the poll.
Let's give it 10, 20 more seconds and then move on.
Okay.
Okay, people aren't obliged to vote. We're very free here. So, okay, so that's good. So our audience, 67% of our audience think that to some extent that the adaptation and progress we've made in linking social protection, humanitarian CVA has put us in a better position to manage these crises. Good, that's encouraging. I think technically, yes, I personally think technically we have better programming, we know what to do, we just have to do it. Top 2 challenges. Yeah, again, I agree. So coordination, 69%, but we've heard that probably we're getting better at this. We've seen progress. And funding. I might even say that funding is bigger. And funding can influence these. So donors, please listen and use your funding well. Okay, let's stop sharing that. So I'm going to ask our wonderful panelists to try and do the next bit in about 10 minutes to save us some time for questions. What are your thoughts on this? And who should I start with this time? Okay, so other way around. Rosie, after you.
Thanks, Julie. I guess I'll try and talk quickly. The first thing I wanted to say, and it responds to the feedback we got on the poll about coordination being one of the top 2 challenges, but it also links back to what you were just saying, Catherine, about the need for better coordination in data management. I think we saw in the COVID response how good data was a key enabler of being able to work with and alongside and in support for national social protection systems to respond to new needs in the context of shocks. We have to, make sure that the information that's held is consolidated to avoid the duplications, the errors, missing people out, etc. I think cash working groups and other sort of forums are quite well placed to help circumvent these barriers and improve collaboration and share expertise as a preparedness measure. And we need to kind of think about it, well ahead of time. But they need to think these things need to be organized in advance. They have to be context specific, regular, and critically inclusive of the government officials that are involved, so that we can clarify ahead of time the role of different international agencies. There's kind of lots I want to say in response to this question. We're faced with an unprecedented humanitarian challenge globally, and we know that business as usual for humanitarian actors just is not an option. With the UN estimating 274 million people in need of humanitarian assistance this year, and social protection, linking social protection to humanitarian cash is, I think, a key is one piece of the puzzle, an important way which we can kind of get away from business as usual and deliver great efficiency and impact. But we also need to look at this in terms of preparedness from a household perspective. COVID's really highlighted the importance of regular, routine social protection in supporting household resilience to shocks and stresses. And I think that the challenge ahead of us now is ensuring that COVID sort of forms part of a narrative around social protection that propels a longer term vision towards universal social protection. And it's imperative to invest in the systems rather than seeing it as a one-off event. So I think we're better prepared, we've got better frameworks, experience, we're building better understanding of impact, but our challenge is perhaps in maintaining the momentum and ensuring that our ways of working continue to be informed by and adapted to people's real needs and their challenges. Thanks.
Thanks. And thanks for, that point that Nupa made earlier and you've just made again. The impact of an event is determined by the ability, the resources you have to cope with it. That's such an important one. And I am so much in agreement on routine social protection. Nupa, over to you, please.
Thanks, Julie. What stood out for me in that poll was coordination and funding. And so the point that I'm going to make is something which links the two. I think what is really important is that donors are better coordinated among themselves. The humanitarian donors and the development donors, for example. We can't have, COVID has really shown us how social protection works in humanitarian situations and contexts. And I think it's high time that donors are better coordinated with their own portfolios on humanitarian. So very often the same donor has a development side of a portfolio for cash transfers and social protection, and then there is this other humanitarian portfolio. So those silos really need to break within the organizations, within the donor agency, but also across different donor agencies. So better coordination so that, I'm not saying that they should be merged, because there are humanitarian principles that will have to be upheld. But it's what I'm talking about is better collaboration and better aligning of what we're doing so that one fits into the other and supports. We can't, moving forward, it will be really sad if, one hand is trying to build a system or something which is going to lead somewhere, and the other hand is constantly, in the process of either dismantling it or, not encouraging it to move forward. So that is something which I would really like to see happen, to change in the future. And I see a lot of hope in the ECHO guidelines, the cash guidelines that have come out. When I was reading it, I could see social protection written all over it. Maybe it's my biased brain, but that's what I could see. But it will be really good to see how it is practiced, how it is implemented in practice, and how it gets out of that document and we see things on the ground. So for me, that's the point really here.
Thank you so much, Nupur. Matthias, over to you.
Okay, I have a mostly optimistic frame of mind about this. I think the speed and the magnitude of the COVID response was really fantastic to see and to be part of, and it mainly because it overwhelmed individual agencies and sort of required a collective response. We wouldn't have been able to do what we did without thinking about how to respond collectively in a sort of more joined up way. But in the long run, we're still not very good at integrating, right? There are fundamental sort of structural issues of trust. The bank operates through sovereign governments. Humanitarian agencies are less, that's less the field in which they are comfortable and so on. And maybe we should think about being opportunistic, right? And not worrying about coordinating, collaborating in a sort of grand sense, but being opportunistic. And one opportunity, Catherine, I think you talked about this, and Nupur also about migration and displacement and refugees, and maybe thinking about certain specific areas where we can and should work together more closely. And this is an area where clearly it's going to only increase in importance as, say, climate change begins to bite, right? So there may be areas where we can think about coordinating more effectively. Let me say one other thing, putting my World Bank hat on, and that has to do with fiscal space, right? Excuse me, debt is increasing, sovereign debt is increasing. There's limited room to increase expenditure. We all want to develop systems that can be in place and respond and so on. And I think what we have to do is to be clever about reorienting expenditures. And under COVID, I think, I can't remember the number exactly, but it's something like social protection spending, domestic spending went from 1.5% to 2 point something percent of GDP. And that's a huge jump. There's not much room to increase that from domestic resources, at least the way things are now. So thinking about moving from subsidies to income support, right? Or other things like that we need to think more creatively about fiscal space in order to make these sustainable for the long run. Thanks.
No, those are really good points. And then we get into all the complexities that development faces of political economies and what governments feel they can or can't do. But, I think it's fascinating that we're having a conversation that spans sort of frontline humanitarian work to, government fiscal space. And these are the sort of conversations we need to be having. So, Catherine, back to you.
Thank you so much. I absolutely agree what Matthias has just highlighted, and Rosie and Nupur also have highlighted. There is an importance to act very quickly and really take any moment that gives you the space to do what can be done to do it. We still lack sometimes the really close collaboration of cash and social protection working group members at country level. And I do think this is where we can all really feed in support with evidence, like SPIAC-B, thanks to Nupur and many other colleagues, promoting that and building evidence, what can work, what cannot work, and pragmatic solutions that work also for local actors that are at the front line. I think this is something very essential because this new crisis is unprecedented, as Rosie has highlighted. And if we're talking right now about 45 million people affected by food insecurity or close to famine, right now, just not even East Africa or Sahel alone, and we see the ripple effects of all the other issues, that's very scary. And I think it's a wake-up call that we need to really take action now. The other aspect that I do think, someone I think in the chat was asking already about what's happening with social protection in the Ukraine crisis response. I had the privilege to be deployed there for a couple of weeks, actually in another role, not in cash or social protection. But what I could observe was very amazing to see that within Ukraine, the existing social assistance program continued even for displaced people inside Ukraine. And given what is happening in the East, that is something very amazing, given that government in some departments could not function anymore. I do think humanitarian actors also, we need to be a bit more humble and acknowledge what the role of national government is, where this is functioning and efficient, not double ditching, but really doing no harm to existing mechanisms and make systems better, build stronger and more robust systems, in particular for people that have crossed over the border. So those that were, let's say, lucky enough to cross over into the European Union countries, were receiving this immediate status of protected kind of refugees and protected status to be able to access benefits like EU citizens. But those that crossed over in other non-EU countries had a bit of a challenging situation. So I do think what we can learn from that is harmonizing approaches and frameworks, because we know that with the Syria response and with the Syria displacement crisis, that was not the same. And I can say that as an EU citizen, unfortunately. And so we need to really see that everyone is the same. People that are displaced and vulnerable are affected by multiple issues, and we need to support with the systems and with the open arms that we can afford. Because if we don't, social crisis and social cohesion will further be torn apart, and then we face much more issues than we do right now. Thanks.
Thank you. And then just before we go to the questions, a one-line takeaway from each of you. You know, what should we be doing to try and ensure countries can cope and vulnerable populations manage this next crisis? I know you've already come up with loads of brilliant ideas on this. Feel free to repeat something you've already said if you think that was the most critical thing. But one key recommendation or takeaway point facing this next crisis in how we work together in this area. Oh, I didn't tell you who to start with. My goodness, I'm failing here. So I'm going to go back to Rosie.
Thanks, Julie. That means mine. I won't risk having mine said by someone else, so I have to come out with another one. I would focus on this issue of continuing investment in regular, routine social protection, support resilience at the household level to shocks and stresses. We're not waiting for, you know, the next shock. We're very much in the eye of the storm, and we need to continue that investment. Thanks.
Brilliant. So, Nupur.
Thanks, Julie. And I'm going to just build on what Rosie just said. Investing in social protection systems and preparing systems is extremely, extremely important. In UNICEF, for us, it is mandatory. You know, whenever we are doing an assessment for humanitarian response, it is mandatory to look at the social protection systems and assess their the usage and its feasibility of how we can leverage the system and build upon what already exists. So that is something which I would say that, you know, yes, we need to invest in systems, making them more, increasing their coverage, their comprehensiveness, inclusion, and making them more risk informed. That's something as a part of preparedness. But when when there's a crisis and we are about to embark on a humanitarian response, particularly a cash response, then including elements within our assessment to include social protection system and also the other actors, what's going on social protection, so that our humanitarian response is better aligned and can complement or leverage what is already going on, so that we're not, you know, creating these two parallel systems that are in conflict with each other.
Thank you. Matthias, over to you.
Thanks. Of course, I agree on the need to build adaptive and responsive and flexible systems and have them in place. That sort of goes without my saying it. Let's put it that way. Let me say something slightly cautionary, and that is on political economy and context. Okay, so if we sort of pivot to the ongoing crisis, the Ukraine crisis, and the global price and markets and supply crisis, I'm dismayed. We need to think more broadly than the world in which we operate to do it more directly. I'm dismayed that price and trade controls are the most popular policy responses, interventions to the current crisis. I mean, the evidence against them is just overwhelming. India banned wheat exports the other day, right? And we haven't really learned, or we haven't been paying attention to the broader context in which we operate, right? I think banning wheat exports is clearly only going to make the price and supply crisis in the rest of the world worse. So, you know, we have to think a bit more broadly and think about the political economy and the context in which we operate. Thanks.
Great point. We always forget, don't we? Catherine, would you like to give us that final one-liner?
Very short. I think involving people and providing more opportunity for leadership of the affected people and what they want to see in social protection responses is critical. And we sometimes forget we're all doers and we're maybe policy makers, that in the end, those people can best actually formulate what is going wrong, why they're not receiving the entitlement, or that they were not aware to receive the entitlement. And very clearly, a rights-based approach and looking and further demanding and building actually a social protection floor for all, given that half of the 45 million people that I talked about that are now food insecure, these are children. And so we're talking about the next generation. Matthias was highlighting before the socioeconomic impact of, longer term effect on children that are malnourished, that are not able to go to school, that are interrupted in their livelihoods and in their well-being. And we know that this is super critical for the future of this planet. So why we still are talking about this demand and we're not able to fulfill it, I don't know. But I would hope that we all take action. Thanks.
Thank you so much. And as ever, this is completely my fault, but we've sort of run over time with the discussion. But we have got some questions, and I think we'll start. At the moment, we are all thinking about the Ukraine crisis. There's been a massive humanitarian response. There's been a massive response by government. Some people say, actually, no, we shouldn't be there. We should be focusing where those folk are most vulnerable. But, Tom Russell from FCDO has asked us, have we seen any lessons learned from COVID applied to the Ukraine response? And, now it's been touched on that we're still to feel the full impact of COVID, which has been compounded by the Ukraine crisis. But is there a risk that because in a way COVID's become normalized for us, rather privileged people in a Zoom conference, we're sort of managing it now, we've got our jabs, are we failing to take account of how it's still ongoing and it's still impinging on us? So continuing effects of the COVID crisis, and what have we learned from COVID that we're applying to Ukraine? So who would like to, feel free to jump in here, people. Come on, folks. Oh, thanks, Nupur, sharing information. Okay, I'm going to call you out. Matthias, give us some thoughts.
Okay, so Ukraine and COVID are very different, of course, right? There wasn't a migration response to COVID. The impact on markets is quite different. So I think that it's hard to draw lessons more broadly. I think there are some specific things that we've learned. I mentioned the fact that programs are becoming less conditional, less dependent on conditionalities, more interested in delivering services quickly. There's a broader sense of integrated packages, comprehensive services, links to human capital and other sorts of services that I think are fundamentally important. That's new. And then the reinforced lessons that having existing social protection systems are much more effective than the ad hoc responses that predominated under COVID. But fundamentally, I think one other thing is the fiscal space issue, of course, that we're a little more careful about how we are managing this response to the global price crisis and market crisis. But fundamentally, also the lesson that everyone has highlighted here, that we are able to collaborate and work together to try to engender an effective response, I think is profoundly important.
Can I quickly come in here, Julie,
Please,
on particularly the Ukraine one? And that's a very good question. And Tom, I want to draw your attention to, first of all, the webinar that the SPIACB working group on linking humanitarian action and social protection organized. I think it was last month, specifically on Ukraine and on the Ukraine crisis. And we had a representative from the government of Poland who was talking about how the social protection system is being rolled out, and how people, refugees from Ukraine are being included in the program. So that is one. And then there's another podcast again on socialprotection.org. I'll try and find the link to that podcast that specifically talks about Ukraine And my colleague Gabriela Erba, who leads our work on humanitarian cash transfers, and he was there in Ukraine. And it talks about UNICEF's own, experience of working with the government in Ukraine to scale up cash transfers with the government system there, targeted specifically to children living with disabilities and a few more other categories. But do listen to that podcast. It's a good one. So there are quite a few learnings that have emerged from COVID that are being applied. They're not being applied consistently, and there is a lot more that we can do. But I always try to see the brighter side of things. So I'm constantly looking for those fewer and smaller good examples that one can look at and learn from. So for me, there are some lessons that we've learned, and then there are also some lessons that we have not learned. The amazing amount of system that exists already in some of the countries around Ukraine, and also Ukraine is something which I think, again, as humanitarians, we didn't really look very closely at when we started embarking on our Ukraine response. So that's something which is something that we need to reflect on as humanitarians. And again, it's a very good question that it helps you to sit back and analyze our role and how do we approach humanitarian crises. And how do we look at what already exists, and how do we build that into our plans, humanitarian plans? So good question, not fully answered, I know, but there are some good resources around to look at them. And I think we'll have to continue engaging on this issue. Oh, well.
Somebody else like to jump in? I would just say that whole series of podcasts from ODI is absolutely brilliant. Fantastic discussions, brilliant summaries. I listen to all of them religiously. And I think Ukraine definitely, what did it show us? It showed us how much we fail to analyze systems and take national environments, national working environments as seriously as we need to. Would somebody else like to jump in on what COVID taught us about Ukraine, or shall we focus on the continuing impact of COVID? Can we untangle at all the different crises that are going on, and to what extent is that useful?
Yeah, maybe I'll say something about the second question. I understood it as, are we, and apologies if I misunderstood the question from the colleague, but I understood it as kind of, are we taking our eyes off the ball with regards to COVID? And, I think the question for me is, are we sort of keeping our eyes on the ball in terms of the needs and the vulnerability and how that's changing? Because, at a kind of household individual level, a shock becomes a crisis if people don't have a sufficient level of well-being in the first place, if they're not already supported. So for me, what it means to keep our eyes on the ball is to keep our eyes on the universal social protection agenda that we're all committed to and working towards. The combination of COVID, conflict, climate change, the spillovers from the Ukraine-Russia crisis, they've devastated people's lives, livelihoods, national economies on just a staggering and, as Catherine said, frightening scale. But I think we need to look at this from the perspective of individuals, from households, where their needs. And COVID has shown us that the work that we've been doing to strengthen social protection systems and to deliver on the promise of SDG target 1.3 is on the right track. But we need to continue investing in the direction that we've been going in so that we can ensure progression to universal social protection. So for me, it's not a question of, are we paying sufficient attention to COVID or not? It's kind of, are we on course to meet SDG target 1.3 to ensure universal social protection for all? Thanks.
Thank you. We have other questions, and they're really interesting questions. Should we be looking at a different form of global funding? A question about what you do when there is no government to which you can align support. Got 2 minutes. Shall we go for the second question? So what do humanitarians do when the government is doesn't have systems or is really failing, and you don't want to align? Got 30 seconds each on that one. Nupur, you wrote the first guidance. Tell us.
Okay, I'm not going to speak. I'm going to post a link on the chat box of the Fragility Forum. There was a session in the Fragility Forum on social protection, and which had examples of four, I think three eventually made it to the panel. So three examples from three different contexts of how the linking can be done in fragile contexts, especially for displaced populations. So that's something I'm going to post here. There was also a podcast that brilliant Matthias was a part of on the same issue, which brings some studies together. And I can't find that link, but I will try and find that link for the podcast and post it here. But let me first post the video for that session. So I'm not going to give any answers, just listen to that, and it's a good panel discussion, which will answer that question.
Yes, and we have some excellent resources on the CALP site. We've linked to lots of other places and brought together some key resources. So we'll share those as well. Anybody else? Quick. Got a minute to go. Other resources?
Let me quickly jump in. Sorry. I do think we don't have any context where there is no government or no government authority that claims to be the government. So the issue is always, how do we work with even non-state actors that claim to be the government or take responsibility? And this is where obviously humanitarian principles come into play, and the issue of human rights as well, which is always a tricky thing to balance. In the end, it is about people's survival, right? And we want to ensure that people do not die or are in very dire situations for a long time when we could assist. So finding the right balance between that is a key driver for humanitarian actors. But at the same time, strengthening systems and strengthening even those actors that may be not always considered the right actors, but it is for the people of that context. So I do think we have seen CCD members a lot of work in Mali, in Somalia, in other contexts, in fragile contexts around South Sudan and other places where we have challenges or where there is an emerging social protection approach, and it is working if we're engaging, and it is not easy, but it warrants everyone to be on board and pull in the same direction. And this is, I think, we need to take away from here. Thanks.
Julie, very quickly, let me say
Please.
two things. First, there are cases where the World Bank operates only through humanitarian and other partners in order to deliver services. The most obvious being Yemen and Libya, and then there are many other examples. But then I also think we need to learn also from cautionary tales where things have not worked so well. Eastern Bangladesh, Rohingya being one of them. So I think there are lessons to learn out there from this kind of interaction.
Yeah, and I would also point out the work by BASIC at IDS, which is looking at very much at this question. Okay, so our time is up. Thank you so much, everybody. This has been a really interesting discussion. I've learned so much, and thank you for making the time for this. And thank you to our participants and also to the team that's been supporting us behind the scenes. So thank you very much, everybody. And we'll be posting the video on the CALP site and on YouTube, and we'll try and link some interesting resources, some relevant resources to it as well, including the ones mentioned here. So have a great rest of day, and looking forward to coming across you all again in one context or another. Thank you very much, and goodbye.